Hello, my name is Nurse Pauline RN. Welcome to my channel. Please hit the like button, subscribe and share, please. The topic of my video today is Fundamentals of Nursing, Exam 1, and we are on Part 7. We will be doing questions and answers today. Patients on tube feeding, experiencing abdominal bloating, nausea, and vomiting. What is the first thing you do? The first thing you do is turn your tube feeding machine off. That's the first thing, and notify your doctor. What is the position of your patients while they are on tube feeding? Your patient head of bed should be elevated to prevent aspiration. Elevate the head of the bed 45 to 90 degrees. What are the routes for your tube feedings? We have two routes we're working with today, and this is your GI tube, which is your gastrostomy tube. Your GI tube is placed in the abdomen, and the second tube is placed in one of your nostril, and that's your NG tube and your gastrostomy tube. Do you know the sites of your subcutaneous injections? Your doctors has ordered sub-Q injection for your patients. What site are you going to use? You can use your thighs, in front of your thighs. You can use your arm at the back or side of the upper arm. You can use your abdomen 2 inches away from your belly button. What are the sites if the doctor has ordered for you an IM injection? IM injections are administered in the muscles, and you'll find these in the deltoid and in the thigh, in the vastus lateralis. You can also use your lateral hip. This is your ventrogluteal site. You are gonna be ordering a TB time test. Do you know where you're gonna be administering this intradermal injection? It will be placed under the surface of the skin in the epidermis to form a bubble or a wheal. Usually is placed in your lower arm. What gauge IV would you need to administer a blood transfusion? What gauge IV would you use to administer a blood transfusion? If you see this on the examination, it's a number 20 needle. Are the PCA or techs allowed to ambulate your fresh post-op patients? The answer is no. Your fresh post-op patients are unstable patients. Only the registered nurse ambulate post-op patients. Only the registered nurse takes the vital signs. The tech do not take care of any post-op patients. If you see it on your exam, it's the nurse is the only one who takes the vital signs and ambulate the patients. The text can be there as standby assist, but for safety, when you see it on the exam, it's a RN delegation. If your patient is a post-op patient, maybe on the third day, the patient is ready to go home, it's discharge day, that means the patient is stable. The tech can take the vital signs. The tech can walk this patient if the patient is going home. The patient is stable. Nurses takes care of unstable patient. In your exam, you see that RN takes care of unstable patient, not the tech, not the PCT. On admission, if your patient told you he uses a sleep apnea machine, if your patient told you that he has a history of sleep apnea, what should you ask the patient? If your patient has a history of sleep apnea, you'll ask the patient on admission if he or she has a Cpap machine home. If the patient has a machine, ask them to bring it in. Family can bring it in to the hospital. What your patient has a colostomy. What is the normal color of a stoma? Remember, you have the stoma and the colostomy bag is clipped on or attached on to the stoma. What does normal stoma looks like? What are you going to document? The answer, normal, should be pink to beefy red. If it's not pink to beefy red, if it's gray, that's signs and symptom of infection. Notify your doctor. If you are unable to, your patient comes in, no veins, small veins, you cannot get an IV in. 1, 2, 3 nurses have tried. You notify the doctor, and the doctor will order a Picc line for your patient. A Picc line, after it's inserted, we can order antibiotics, we can order parenteral liquid nutrition, IV fluids, all medications in your Picc line. You cannot use a Picc line until it's confirmed with X-ray. It will be verified by X-rays. Picc line and NG tube have to be verified by X-ray before using. What are the locations on your body you will assess for cyanosis? You will find cyanosis on the cheeks, nose, ear, lips, fingernails, oral mucosa. Where in the body will you find jaundice? You will find jaundice on the skin and in the white of the eyes. I'm going back to my pressure injuries. Don't forget, you'll find your pressure injuries on your sacrum. I don't know how I did not say sacrum. First place, turn your patients off the bony prominences. The immobile patients of their sacrum is risk for breakdown. How do you prevent pressure injuries? How do you prevent it? Prevention of pressure injuries due to illness, immobility, critical ill patients, you turn and reposition them every 2 hours. You apply barrier cream to the areas of bony prominences. Assess your patient's nutrition and hygiene. Make sure the patient's hygiene is good, especially those with diarrhea. Make sure they are clean. They are priority patients for baths in the morning. Prevent them from having skin breakdown. Like, share, and subscribe to my channel. Thanks for listening. Have a blessed day. Stay tuned for number 8. Fundamentals of Nursing Exam 1. Stay tuned for number 8. Thank you. Have a good day.